Exciting medical news part two. Pancreatic cancer is one of the deadliest cancers. And if we had a screening test for it, the same way we have mammograms for breast cancer or colonoscopies for colon cancer, we actually can make a huge difference in the treatment of pancreatic cancer. Pancreatic cancer is only 3% of cancers, yet it is the third largest killer because treatment, whereas it's really evolved for all other types of cancer, has not really evolved for pancreatic cancer. So now they're talking about something called a liquid biopsy, which essentially is just a blood test that could tell you if there are certain proteins or RNAs that might suggest you have pancreatic cancer. So that instead of having to get like an image or something more invasive, you just get a simple blood test. It's as good as 97% detection for stage 1 and stage 2, which is huge. It has something to do with the way that the cancer is shedding its genetic information, which is the RNA in something called the exosome. It does so at a much faster pace than the regular cells in your body. So this blood test can detect the abnormality and tell you, hey, you might have some sort of cancer, maybe pancreatic cancer here. The pancreas is in a weird area where you might just feel abdominal pain and some mild weight loss, so you never think to go to the doctor, and that's why it presents usually in stage 4. But if you can detect it when it's stage 1, you cut it out when it's much smaller, and you actually dramatically increase the rate of a cure. Otherwise, stage 4 pancreatic cancer has to go through chemo and immunotherapy, and it still does not achieve cure the same way that it would have if it was smaller and you cut it out earlier. Hence, that's why the screening here is huge if we can actually break through with it. We're already using these blood tests, but once they have the cancer, and it's to see how well the cancer is responding. So let's say you're releasing 100 units of this protein, and then you get chemo, and now you're only releasing 20 units of this protein, then you know that the cancer is reducing in size. But again, what if you could do it before you start all the treatment and you detect it way earlier? That's where the difference would be.